Okay, hi everyone, and welcome to another Facebook Live. Today I'm joined by Mike Shikashio from aggressivedog.com. For those of you that haven't heard of him, he's an internationally renowned dog trainer and behavior consultant working with primarily aggression cases all over the world, as well as providing lots of different education worldwide. So yeah, hopefully I got that all right. But for those that don't know you, and to kind of make sure I haven't missed everything, perhaps you could just introduce yourself briefly, Michael.
Yeah, thanks for having me, Daniel. This is going to be an exciting conversation. It's one I actually haven't chatted about much, so it's good to be here. Yeah, just focus on aggression. That's my thing. I've been focusing on it for about the last 12 years out of the 22 years or so I've been training. So it's my passion, and what I like to do is just help dogs and their people that have issues with aggression.
Brilliant. And so today I wanted to bring you on specifically to talk about something I noticed that you've touched on a couple of times in some of your recent work, but perhaps not gone into as much detail on, which is this idea of kind of critical thought and critical thinking when you're working on aggression cases, and also kind of when you're navigating, I suppose, the dog training behavior industry, which has lots of new trends, lots of new things kind of coming through, lots of new research coming through. So obviously something that's really important for all practitioners to be thinking about. So I thought perhaps to start off with, it would be useful. Could you kind of define what you mean when you're talking about critical thinking or critical thought?
Yeah, I guess, I've never really been asked that question, but for me, it's what it sounds like. You're kind of critiquing your own thought process to make sure that we're not missing anything. And so I'll give you a little history. Kind of when I started with working aggression cases, I had done the typical training route of learning from a lot of different mentors and books and courses and things like that. And so you end up a lot of those the teachings at that time were ABA focused. And I love that. My mathematical side of my brain is like, it's very reductionist in that way and very analytical in how I approach problems or solving problems. But when you first start out, it's very simplistic. You think about the operant training and classical conditioning, things like that, which is absolutely important and crucial to understand. So I started with that for a while, but then I realized I was missing things in a lot of my aggression cases. Maybe I wasn't seeing like an underlying health issue, or maybe I wasn't thinking about how much the pet guardian was influencing the animal's behavior. And so my mind started to branch out to be like, I've got to make sure I'm not missing these things, because if I take that reductionist approach and I like kind of look at things through an ABA lens, which again is very helpful to understand behavior, I might miss something else that can help this client. So for me, a critical thought process is like taking a step back. Let's look at the whole picture. So that way we can identify potentially other areas that we need to put a little thought into, like critique, like, am I taking too much of a simplistic reductionist approach, or do I need to see things through another lens? And so I've, over the years, have just, added all of these different lenses to look through, and these different tools and approaches to look at changing behavior. And I think it's important, especially in aggression cases, because if you give the wrong behavior change strategy, it can often send the case in really odd directions. So, and I'm sure we can unpack that further as we go along in the conversation.
Yeah, so I mean, I imagine obviously you've had, and I think even in your course you discuss you've had some very complicated aggression cases, right? And it can be really difficult to try and see that from such a broad perspective to encompass all those different sciences that you might include when you are considering an aggression case. But I suppose, how is there a kind of particular approach that you would say is useful to you in terms of being able to kind of access all that information, access those different ways of approaching those cases?
I think having a bit of imposter syndrome helps sometimes,
Yeah.
because it really does it helps you again get back into that critical thought mindset. Because if we think we know everything about a particular case or particular behavior problem, we might run into some issues with missing some things. So for me, I'm always making sure I'm second guessing and triple guessing myself to to ensure that I'm not missing those important components that might be so crucial to address the case. And so I beat myself up sometimes, right? Like in terms of really thinking through a case. But I think as you go along, that sort of process will help us making sure we're looking through those different lenses. So for instance, we might talk about, we have the science, and I'm a person of science, but I don't consider necessarily myself a scientist. I'm sort of an applied science person, right? So I take what the folks with the PhDs, the researchers, folks like yourself that focus on a particular area of science, and extrapolate the information you pass down to us, right? And then I can apply that. But I also have to be careful because I might not have a full understanding. And that's where that imposter syndrome comes in, right? For instance, I can start learning about neuroscience, but I'm not a neuroscientist by any means of the measure. But I can start to extrapolate some of that information passed on by folks like yourself or Dr. Kathy Murphy, and use that in my work. But I'm also careful about saying, I don't want to be a pseudoscientist here, right? Or just start saying, oh, they said this, so it must mean this, right? So, yeah, kind of a long-winded answer to that's how I'm like making sure that I'm keeping myself in check, but also ensuring that I'm not missing things. So a lot of navigation in that.
It's interesting because it is such a difficult line to kind of walk, isn't it? Because there is that kind of risk into kind of treading into that kind of almost like pseudoscience territory, right? When you start hearing people, you see things like on Facebook where I think people are like, yeah, you go do this activity, it's going to cause endorphins to be released, it's going to cause dopamine to release, it's going to change your gut microbiome, this one thing. So and it's really, I think, valuable that people are thinking about those things, but at the same time, then obviously we need to be questioning whether that kind of application is necessarily correct in that case as well. So it's a super fine, hard line to walk, especially for people like us that are kind of behavior consulting. Obviously, I'm quite interested in neuroscience, but I'm not interested in kind of a bunch of, I'm not interested, but I'm not obviously trained in a load of other different sciences. So again, it's kind of having to take in that information from people that are very, very skilled in that, but also not kind of misinterpret it. It's scary.
And it's an interesting thing too. I've seen it lately in the like conversations on social media and different dog discussion groups, is that I think what happens, I think, is that we're all guilty of at some point reading a paper or seeing something that somebody says, some good researcher, somebody says, and taking that and kind of bending it to how we want to apply it in our work. And that can be a good thing or a bad thing sometimes. But overall, I think it's a good thing as long as we keep saying, let's look at science. Let's keep looking at the science. We might screw up, and I've screwed up plenty of times. I've said things that, I remember hearing that from this particular researcher, but then as I go along, I'm like, oops, I maybe didn't quite understand what they're talking about. And we see it all the time. And I think it's okay to be guilty of that sometimes, because then we check ourselves again. We're like, okay, I made a mistake there. So now I can change what I'm saying or adapt what I'm saying because I'm understanding the science more. Because let's face it, dog training, anybody can be a dog trainer. And so I'd rather have a dog trainer that has at least looking at the science than a dog trainer that is completely not, or just relying on folklore or, the things that we pass down through tradition, which isn't in itself always a bad thing. But I prefer, at least we're leaning on the science, we're taking what we can and applying it as best we can. But until dog training is like where everybody has to have an advanced degree, we're going to keep seeing people extrapolating the science. And for me, that's okay, as long as there's that critical thought process of saying, okay, let's make sure what we're saying and doing, let's just double check, let's triple check that, and then let's evaluate it over time too. Let's look at the data in our own work, even what we're recommending individually to clients. Is it working?
And that sort of hits on something that's quite interesting to me as well recently. So have you heard of polyvagal theory?
I've heard of it, but I don't know anything about it. So
don't worry. So so it's essentially this theory, which I would describe as essentially completely unevidence-based. So it's this theory of the nervous system that the evidence for which is absolutely shocking. So from a kind of neuroscience perspective, it doesn't make any sense. It's kind of how I would put it in a very kind of blunt way. If I was going into it in more detail, I'd perhaps be more tactical. But to me, it doesn't make any sense. But one of the interesting things about polyvagal theory is there are polyvagal theory based therapies, which for some people do seem to be quite successful. So then that gets into this kind of interesting question, right? Of if we rely on a theory that's, say, not accurate or doesn't make any sense or isn't scientifically based, but it has kind of a clinical utility in terms of it makes a successful difference for the dogs we're working with. There's not, I haven't really structured that into a question, but what do you kind of think of that kind of dichotomy?
I think it's going to happen, and I'm sorry, I mute myself because there's a lawnmower going outside, so I apologize if there's any too much noise in the background. But yeah, I think that's going to happen, regardless of what we do. It happens all the time, right? And again, as the dog train community, we like our shiny new things, and so we hear about some new theory or something. We may not be in the seat that can actually evaluate if that's true or not. We may not have the scientific or academic training or knowledge about a particular topic, so we do that a lot. And again, it just boils down for me to, I think as a community, we help each other too. Be like somebody like yourself, but I don't know about that. And whereas somebody else like, ooh, did you hear about this cool new theory? Like this is totally applied to dogs, and they start applying it to their clients, and that, can become problematic. But I think it's a community that's also helpful when we have these discussions, because we can critique those particular theories or those what we're seeing passed down from academia. So yeah, I mean, it's interesting because you also have, right? So we have as much as we can extrapolate from science, but a lot of dog training areas and things we do haven't been studied or really can't be studied from a safety and ethics standpoint, especially in the aggression space. That's the problem with aggression or aggressive behavior, in the sense that the problem is that it's difficult to study because you can't set dogs up in most of the scenarios where it's just not ethical to scare a dog or cause a dog pain or do all the other things that a reason why a dog behaves aggressively. So oftentimes we are relying on, the art of training or things that may not be backed by science. Some of the defensive handling techniques I teach, right? There's no studies or research on that. There's nobody saying, oh, this will totally work. Or did you see the data point on that? There is nothing like that, but we rely on, again, experience in passing those things on. So yeah, it's I don't know if that answers the question either, but it's just some random thoughts off the top of my head about how we get information and, again, apply critical thought to what we're using. It's good to take a look back over our shoulders, like, did that work, or am I just keep doing the wrong thing and just believing it works through my own biases?
Yeah, and I think there's two ways it can go, right? You can be doing the wrong thing, you can be believing it works because of your biases, as you say, or you can be doing the wrong thing and it's working, or you can be doing perhaps the right thing based on a belief that maybe isn't necessarily correct, but it's working for maybe some other reason. And that's kind of, again, I suppose, where that critical thought aspect comes into it, of actually evaluating, although this has worked, can we actually get to the bottom of why this might have worked?
Yeah, right. I mean, that's why I keep going back. Imposter syndrome is a good thing for me because it makes you check, like, are you doing things really, or is what you're doing actually working, or do you just believe it's working through you, again, your lens? But is it something else? There's that critical thought, right? Is there actually something else that's making the behavior change we're seeing? Is it just the straight management? Is it the meds? Is it the dog's health improved? Is it the environment changed? Or is it that actual new theory we put in place because we saw it on Facebook somewhere, right?
Yeah. Yeah. And I mean, the other thing that jumps out at me is we think of your defensive handling stuff as well. So even if we did say, or if someone did do a study on saying you've got that, I've forgotten the name of it, but your leash grip, whether it folds over your folds
Like
over your
lock,
hand, leash lock. Even if someone did a study on that, right, and said this works for controlling the majority of dogs on a leash, I'm assuming there's going to be some dogs, particularly I'm thinking kind of very, very strong dogs, where we maybe want to be thinking about different approaches. And obviously that's quite a simplistic example, but again, you're going to, even if you've got something that's evidence-based as a solution, you're still going to need to be able to critically analyze whether something is going to functionally work in the given scenario that you're trying to apply it to, right?
Yeah. And that's where it helps to have, we start to add a robust toolbox. When I'm talking, when I say tools, I'm not just talking about like actual dog training tools, but all the different approaches and techniques we'd employ in an aggression case starts to help. And that's why it's so helpful to can, again, build in those critical thought skills. Because here's what I was thinking too earlier was that um, the critical thought gets lost when we kind of sit in our own echo chamber, or we sit in a particular space where we don't get out and see what's happening around. And I've realized this so much more, and I keep wanting to talk about it more because it's something that'd be so helpful for, I think, any industry where you see a lot of fighting or people having issues with what the other side is doing or something like that, is just seeing other cultures, like seeing the culture of, let's just use dogs, like the culture of dogs, if you just travel around, is so different. And so sometimes you'll see in these really micro discussions or micro focused discussions of, let's say it's a particular technique, let's say a no reward marker, right? We had that big debate years ago, and it was like, oh, no reward markers. Now you're an evil person if you use a no reward marker. And it's good to have those discussions, but I find that when somebody gets in such a narrow lane of like, this is all right, I'm on no reward marker, team NRM, right? So, or a team anti NRM or something like that. Let's say we call it like that. And then, you get so micro focused on that you lose some of the critical thought of like, oh my gosh, there's this client that's now using the NRM, so now I can't work with them, or this is awful, that's the thing I got to focus on. Where when you realize that that's just such a small part of all of the things that we should be discussing in the world and behavior of dogs, because let's use an example of crates, right? We use crates in the US as like management tools. In some countries they're illegal, right? And we see other tools, of course, being banned now and becoming illegal. But it's, in some countries they eat dogs. And so we have, when we step out and we take a little critical thought about somebody's culture, maybe they're from a culture where they treated dogs very poorly, and we go into that home and we see them treating the dogs maybe poorly, or something that would be a complete shock to us or that person, because they haven't stepped outside of that micro discussion of no reward markers, right? And this person's like, no reward marker, like I beat my dog with a newspaper when he's being bad, and that can be a complete shock to us. So I think that's, again, when you step back and say, okay, it's really important to think this through, so we can best help that client and the dog. Because if we stay in that one lane, or that reductionist kind of view on changing behavior, it narrows us, right? So yeah. Again, another just a random thought off the top of my head, but
No,
I
I think that's
discussion.
really interesting, because I mean, I think my understanding is there's not not something I know a lot about, but like with politics, politicians tend to find that people that support different parties tend to have different values as people, and when they are trying to design their policies to appeal to as many people as possible, rather than trying to say, oh, you should follow my policy because it's better and because it's right and because it's whatever, they'll say, if this demographic of supporters tend to be particularly patriotic, then they'll focus on making their policies appeal to patriotic people. If this demographic of supporters tend to really care about the environment, then they'll focus on, so kind of rather than rather than saying you need to be on my board with my policies because of this, it's trying to kind of get your policies to kind of fit with their current worldview. Because getting someone on board saying, okay, this policy is actually really good because it actually is helpful for the environment, or because it's actually really is a great thing for your country, is easier than trying to shift someone's whole worldview to saying, actually, do you know what, that patriotism thing doesn't really matter anymore. We need to be thinking about this, and this.
That's some good critical thought right there. I love it, right? Because you're thinking through how to change. You can't just go out in the world and be like, all right, I'm going to change everyone's mind on the let's use again the no reward marker like example. And you can't just go out there and be like, all right, I'm going to convince everybody that NRMs are bad or good or whatever. And I'm not taking either side on this. I'm just using as an example. Let's say, I'm going to go out there and use the same message for every single person I meet. that's where the critical thought is lost, because one person's going to be like, I don't even know what an NRM is. I'm still using the newspaper on my dog. And another person might be like, oh, yeah, that's totally true. You know, like my dog sleeps on a Tempur-Pedic mattress and I never even raise my voice. And this, you know, so you have these different views. And if we go out with the world view of like, everybody's going to listen to me on that, that's where we get in trouble. And so that's where, just like we work with dogs, like how we adapt our training strategy to change behavior, we need to adapt our conversational skills and our approaches to dialogue to convince somebody or to change their mind, and using critical thought. Because if we go in that same with that hammer on every single nail, you know, it's going to be problematic. So there's the nuances in that conversation.
Yeah, and it's almost kind of sort of utilitarian, right, in terms of the way you're kind of describing it there. Because I suppose if you were saying, if we're kind of thinking about how we can do, I suppose, the greatest good in terms of welfare for the greatest number of dogs, if we're getting a dog to, or a dog owner, dog carer, to switch from beating up their dog with a newspaper to a no reward marker, I think you'd be really struggling to argue that that's a bad thing for that dog, right? But depending on what you think about no reward markers, and obviously I'm not going to jump to either side of the fence on that today, but if you switch a dog that's using a dog carer that's using no reward markers to suddenly using no reward markers, then that may or may not have a welfare impact on that for that particular dog. So it's kind of contextual depending on the starting point for the case as well, right?
Definitely. And that's, again, looking at the whole case, right? You gotta look at not only the dog, but you gotta understand the people dynamics, the environment, the dog's health, the dog's age, the dog's breed, and start looking at all these variables with that critical thought lens of how much is this really going to impact the case if I do this? How much is the dog's age going to impact the case? How much is how the client is interacting with their dog? All those variables, and then you're kind of juggling a lot of balls there, right? Like you're like trying to figure out which one's going to land where. And I think if we miss that, if we go in with the same approach with every single case, then we're going to miss a, we're going to be dropping a lot of balls in the wrong place, right? So, yeah.
Yeah. I mean, that's super interesting. I mean, so I suppose thinking of kind of that kind of client and the newspaper example, if you have, or I don't know if you have any examples of this, but if you have a client that maybe relies very heavily on punishment-based approaches, and particularly, especially if that punishment is not necessarily working for that dog, or is not, you know, obviously in as I think you say in most aggression cases, a punishment-based approach isn't really going to be very successful for resolving that aggression and obviously meeting the welfare needs of that dog. If you've got a client that's using that technique and you kind of, I suppose, identify perhaps that client has not only using that technique, but has quite a mindset in that technique, in the sense that maybe they were raised using quite strong punishment, they raised their kids using strong punishment. How do you navigate that kind of situation? Because that's so challenging, right?
Yeah, and that's why I love this work. You know, I love that that no two cases are the same, right? You always have differences in every single case. Like you could take the same dog, you know, you could take the same dog, let's say it's a Rottweiler that's guarding a food bowl, and put it in one home to the next to the next. It's going to be a different case in every single home because the environment and the people are going to be different in each case. And so for like, you might have that Rottweiler in one home and they're completely positive reinforcement mindset, and in another home they're a very punishment based mindset. It's going to be two totally different cases. So that's where I go in with that. Again, that critical thought mindset is like, if I go in there with, I'm going to lay out my plan like verbatim, like, you know, the same exact thing. Here's what you're going to do to manage, in just a monotone tone of voice, and just can kind of picture like a robot going through with both of those clients. You're going to have one case go really well and one case not, because it's the same approach is not going to work. So as you're going through the case, you're putting that critical thought mindset in every step of the process. So when we get to the aspect of the client that's really focused on punishment, there we go. We'd be like, all right, so how am I going to convince this client? Because the last client, I didn't have to convince at all. They were great about using the positive reinforcement. This one's using a very heavy-handed method. So I'll actually use an example of a Rottweiler case in Connecticut here. where the dog had history of fence fighting with other dogs and redirected aggression on one of the, especially the female owner. She had gotten bitten pretty bad, attacking them in the car, and also some other additional resource guarding of other items. So quite a few issues in this home. Very heavy-handed, sort of old school mentality. This guy was sort of tough, brash personality. Like, yeah, dog's got to listen to me and be obedient. Can't have this kind of problem in the home. So how do I approach that, right? Like, how do I change that mindset? So first thing I do is get the client to start to empathize with how their dog is feeling, because I can say till my face is blue, you know, you can't use punishment; it's bad; it can make things worse. But if they have that bias in their mind that punishment works, and most people that use punishment see that it works sometimes, it's good at suppressing behavior. It just doesn't change how the dog feels. So first thing I get into start working with is like, how do you think your dog is feeling about that, or what do you think your dog's experiencing when this X, Y, or Z is happening? When they're just trying to, you know, keep their food near them and they're growling at you or they're lunging at you, or they're in the backseat of the car and you try to reach down and their stuffed Kong toy that you put back there is there. You know, what do you think they're feeling when, and you get the answers like, I think he's just trying to be dominant, or he's trying to one up me or alpha me or whatever. And so you get into that conversation next. There's that, all right, so how do I navigate that next step? Okay, I can understand how you think that he's dominating or he's being aggressive, but just like people, I want you to think about what you find of value. And I think this guy's like, I like my guns and my my motorcycles and stuff. So you can kind of painting a picture for person here, but and I say, well, what happens if somebody comes and tries to take your motorcycle away from you? What if you're sitting on it and some guy comes up and tries to push you off there? How are you going to feel? You're going to feel threatened, or are you actually just trying to dominate that person by trying to defend your bike? And then they start to get that thought process going on their own. And so you turn them into a critical thinker, right? In this moment, try to help them really think this through. And the best way to do that is often to just get them to empathize their dog, and like share a human experience that they might have gone through and then apply it to the dog. So that particular client, of course, isn't going to shift to like, I'm going to be like all positive reinforcement overnight. However, you see a significant reduction oftentimes in the amount of punishment they're using, which is almost always the goal. So that's why the navigating of the conversations is where a lot of critical thought comes in. That case turned out pretty well, fortunately, and especially I'm glad the wife stopped getting attacked, because that was a pretty bad case.
Yeah.
But just a shift in their thinking really helped. As well as addressing some underlying pain issues that dog had. So that was an additional empathy talking point. You know, your dog's in pain. What happens if you or your wife is in pain and somebody's poking you or doing these things while you're in pain? And you can see like it's a shift in their mind. Like, oh, that makes sense, huh? And so yeah,
Yeah, it's an interesting one, isn't it? Because I think people have a tendency to sort of almost overcomplicate what's going on in their dog's head a little bit around these sorts of situations. So you mentioned kind of like thinking about, you know, the resource guarding case, whether that dog's being dominant over that resource, whether that dog's, you know, wanting to spite them or whatever that they kind of might have come up with that dog's thinking. But that kind of, I suppose, that route of kind of really encouraging empathy also facilitates them to kind of actually see their dog as more of a kind of a normal kind of rational animal
yeah,
rather
yep.
than up to all these different various things or whatever kind of has kind of been blown up in their head. Because I suppose these things can often kind of spin around in a client's head for weeks and weeks and weeks before they call you, and then there's a little bit of unpicking to do there in terms of some of the biases, some of the beliefs that might have cropped up.
Yeah, and it's sort of like that. They either overcomplicate or oversimplify, right? It's like one or the other, and when they're thinking, and that's totally normal, right? In aggression cases, it's usually overthinking it, and because there's just so much information out there that's sort of conflicting in what they read on the internet. I mean, it's getting better, but it's still there's just so much conflicting information now with social media and things like that. It's just an overload of information. They're trying to apply it to their case, which even if you have all the right information, it's still difficult, right? Even if I could hand select all the information a client could have and get nothing else out there on the internet, it still is difficult because they have to apply it to their case and they have to understand if it's actually applicable to their case.
Yeah, and I suppose that's also kind of the way that we're going to have to go forward as behavior consultants moving forward, because with kind of AI technology and stuff, people can access all that information. They can find out how to train their dog and do all that. That's actually really easy information to access nowadays.
Yeah.
But what they can't necessarily access is having someone that can actually look at their case and assess their case and consider what's going to be appropriate and how we can actually apply this to your individual dog and your individual set of circumstances.
Yes, yes. And think about that for a moment too. Like people are like, well, there's a lot of industries being threatened by AI right now, right? And be like, oh my gosh, the AI is going to replace my job and all of that. And yes, AI is going to replace a lot of what we do. So any of you guys that are trainers or consultants listening in right now too, it's that yes, AI is going to replace a lot of things for us, and it's going to make things a lot easier for us in a lot of ways, and especially in the dog training space, behavior plans, resource information, writing up a report for something. It's going to simplify all those things. But what it's not going to replace is your critical thought. AI is never going to be able to go in and look at all the variables like we can, and especially when it comes to a complex case. It might do a pretty decent job, right? AI is already diagnosing medical issues based on certain symptoms, but it is not going to be able to, I don't think anytime soon, unravel the subtle nuances in an aggression case, because they can't see, the AI cannot see the relationship between the guardian and the animal. That's what we can see as consultants. So I think the sort of the future of behavior consulting is really going to be focusing on a lot more of us coming in and be like, okay, you've educated yourself as a good client or consumer of information. You know the basics. You know how to teach some behaviors. You know how to get behavior. So they're like new baby trainers themselves. But we come in and we've got the way of looking at the whole picture using critical thought, especially those relationship access things that a machine's not going to be able to do. So
Yeah, no, I think I had an example of that just yesterday. Actually, I had a case where they'd done some, they'd done, I think, puppy school, and they got quite educated on how to work with their dog. And their dog was having some reactivity issues around kind of moving people and busy places. What they'd done, which was really quite impressive, is they trained their dog to sit on a mat, and then they'd taken their dog to a cafe with this mat on, a super busy cafe, and they were just feeding him treats every time he looked at a person, which was kind of along the right lines and kind of along something the lines of something we could use. But obviously what we had to do is look at how we could obviously scale that back a little bit, give that dog a little bit of decompression time first, and then obviously gradually build up to that point of maybe working in a cafe, which was probably kind of the top tier intervention we needed to get to for this individual.
yeah, that's so interesting too. And this age of technology and information that's so accessible is that I have definitely seen it. Clients being much more savvy about behavior and understanding training and getting basic behaviors on their dogs without any help. They get it all online, and and the beauty of that is you're reaching areas of the world where there's no trainers, right? There's not even books accessible to some places of the world, just an internet connection. And I've got clients like all over the world, Pakistan and Norway, and these really there's pockets of certain areas of the world where there's very little information, but the clients are amazing. They like know about like Leslie McDevitt and Trisha Stewart and like stuff that wouldn't have been around 10 years ago in terms of information. So what that's creating is a much more savvy consumer. So again, where I see sort of the training industry sort of shifting towards is, again, a much more educated consumer. They're going to come in and know what to look for in a good trainer consultant, and AI is going to help them. And this is where I think, and I hope, but I think that we'll see a significant shift in the dog training community as well, because we're going to see, because AI is already recognizing it. AI is like, punishment is not a good thing. I was actually doing this earlier. It's like AI is not, like, what are the 5 myths about aggression? And it was spot on. It was like, punishment is not a good thing. Don't worry about comforting a fearful dog. All these really good tips that it's spitting out. And so what you can have is consumers already armed with that information. So when they go looking for a trainer, and they might go looking for a trainer with help from AI too, because AI is this, like, if you have like the Google's Bard, and they're already developing programs that help you shop. Like, let's say you want to buy a new car, you pull up the 7 best dealers in there that all have good Google reviews, and then get the pricing for you and which dealers are the ones that are best and what they're paying for their cars, and it'll spit all that information to you. So think about that when somebody's looking for a dog trainer. They'll also be looking at getting recommendations based on the reviews, but also what a methodology and the techniques that a person's using. So what's going to happen, I think, is you're going to see this natural evolution of what we've been fighting for as positive reinforcement based trainers for years. AI is going to help us because AI is going to steer the consumers to where to go for good training and less of the buyer beware kind of situations. So that's my hope. That's just what's swirling around in my mind these days. But I've been playing around with AI and I've been seeing it, and I see it in conversation. I see it in clients around the world. I see it with my students who are trainers in different areas of the world. And so I've good hopes, for the good things AI do. I know there's going to be some bad things that are probably happen.
Yeah,
But that's with
yeah.
everything. It's with everything.
No, it's really interesting to think about, and I think it's a great training tool for owners and also trainers, right, as well, in terms of developing your own skills in certain areas. But again, I suppose it comes back to the topic of today, in the sense that one of the things that the AI program that I've used, it spits out some really, really good stuff. It can spit out some really good information, but I wouldn't ever rely on that information without then going to double check it and fact check it, because it also seems to make stuff up sometimes. And it, I think it's even made up a couple of studies that I then went to try and find, it couldn't find. So I think it's got such potential to really change the world in terms of what it can offer us in terms of information that's so easy to access. But it's absolutely fundamental that we retain our ability to be able to kind of look at our information and consider, is that correct? Is that even real?
So we need to be the critical thought for AI for now, until it tops us on that as well. But for now, I think we need to be there for it.
Yeah. So it's interesting that you were saying you work with quite a lot of clients internationally, all over the world, and I'm assuming that's via video technology.
Yes. So remote consults like by Zoom, or the typical exchange of videos, Dropbox, Google Drive kind of stuff, YouTube links. So
yeah, so that's it's just interesting, as obviously something that a lot of people have kind of shifted to recently is relying more on kind of those Zoom virtual consults, right? So I just wondered, is there any shift in your approach when you're kind of going through that history taking side of things, that kind of information gathering side of the consultation, in terms of how you tackle that? Because I suppose in some ways you possibly get more information from being able to see a dog in their own home without a stranger present. In some ways you might get less information about kind of the home, the general area. I don't know. What are your thoughts on that?
I love Zoom consults for aggression cases, especially. The reason why is what you just said there. Oftentimes, if you're not there, of course, the dog's going to be much more comfortable. In most cases, there's, of course, some dogs that love people. They just hate other dogs. Those kind of cases are different. But a lot of cases, the dog has issues with strangers. The dog gets nervous or anxious when somebody's in the home, or maybe overexcited. And so they're a distraction to the client. So when I need a client focused on giving me the information I'm looking for, Zoom's going to be so much better for that, because they're not distracted. They're kind of a captive audience in that moment. They're sitting there looking at you on the screen. So most of the time, I always recommend, even if you're going to see an in-person client in your area, do that first consult on Zoom, because most of the time in aggression cases, you're not doing a whole ton of training anyways in that first session. So it's like information gathering, giving the client what's happening in the case, why is the dog displaying that aggression, and then forming the prognosis. What's the potential outcome in the case? And then giving them some basic strategies to work with management and safety, and maybe some initial training. But that's usually 90 minutes of time. Zoom consults can be anywhere from 60 minutes to 2 hours, but 90 minutes about average. And that's, you can get so much more done, so much more efficiently that way, and you're not distracted. Plus, you don't have to travel. So you're not driving for hours. I went from driving over 30,000 miles a year when I was really taking a lot of clients to I think I have 3,000 miles on in the last 6 months. So really just the amount of driving to see clients, not that I see a ton of clients now anyways, but it's just, there's so many pros to it now. And then you can of course support them with technology as well. So if you have a YouTube library, you can have an unlisted private YouTube library, or videos of what the technique or what you want them to do looks like, and you send them that. And it's so much better for them often than trying to explain it or write it in words, right? So if I try to explain how to acclimate a muzzle in an email, it takes forever. And sometimes they don't grasp what I'm trying to do. But a video, send them a video link. Your work's already done if you created the video. It saves you time as a trainer. And the clients often can grasp onto seeing that, because a lot of clients are doing what? There's either listening to audio to learn something or seeing a video to learn something. So yeah, then the wave of education in the like education content space is really made shifts as well in the dog training space, I think. And I think it's just going to continue in that way. I think so many people are seeing the benefits of it. Not only that, and again, clients around the world that don't have access to trainers in their area.
Yeah, and I think that's
Yeah.
obviously a really obviously massively useful one as well, isn't it? If
Mhm.
someone's not got local trainers in the area to be
Yeah.
able to
Yeah.
to access someone further away.
And here's the other thing too, Daniel, is that if you want somebody that can again apply their critical thought experience in a particular type of case. Let's say I have a really unique type of case, a dog, like a dog aggression case over the owner's the resource, right? So it's pretty specific, narrow subset. But you have experts out there that's the only thing they do. Or you have like people that only do separation anxiety or only, and I love that. Why do I love it? Because when you get somebody like that, they've put a lot of critical thought into that particular issue, and they're going to see so many cases of that particular issue that they're going to understand the little nuances that can change depending on the case. And so even now, I have some aggression specialists I refer to that know more about a particular issue in aggression than I do, much more because they've spent so much time focusing on one particular issue. So I that's why I also love online stuff, because that trainer can't travel all over the world, but can certainly take Zoom consults about one particular issue. And here's the thing, guys: if you're a trainer, I always recommend finding your niche or your specialty, because once you get known for it, everybody's going to keep coming for you because they know you specialize in it. So why not try to go to the best at it?
Yeah, and I mean that's an interesting one as well. In terms of when you're thinking about a label as broad as aggression, which is obviously what you cover,
Mhm.
right? As an aggression specialist, because obviously, I guess you're going to see aggression in the majority of your
Yeah.
cases, right? But that aggression, if you kind of dig a little bit deeper into it, could really lead you anywhere in terms of causes, right? It could lead you to a classically kind of fearful dog. It could lead you to a dog that's displaying a sort of an
Yeah.
inappropriate predatory behavior. It could lead you to a dog that's got separation anxiety and doesn't like it when their
Yeah.
owners leave,
Yeah.
so redirects
Yeah.
towards them. So I mean, I think, yeah, there's a lot that even kind of within kind of a realm of dog industry, within an umbrella category, you can kind of a lot of different rabbit holes you can kind of end up in, right?
It's funny because I actually like people that aren't in the dog training space. Like I meet people and like, what do you do? I'm like, I tell them what I do. I'm a dog trainer, and then they're like, oh, but then oh, so I've got this puppy. I'm like, no, I specialize in aggression, right? And so they're like, oh, that's really like specialized. Like, how do you like find business for that? Or like, isn't that too like special? Because like dog trainer alone is like a lot of people like, oh, you're a dog trainer, and of course, you try to as a dog trainer, you actually try to avoid telling people that because they always go, oh, I have a dog or my dog, but
Well,
that
you get
seems like such
tips.
a narrow lane, right? Yeah, like that seems like just such a narrow lane, dog trainer. But then you get into like a specialty like aggression in the dog trainer space. You're like, wow, that's really specific. But people don't realize that's actually such a huge number of cases can be under aggression, right? Resource guarding, dog aggression, dog human aggression, stranger danger. I mean, medically related cases. There's so many different things, and it's even in that narrow space, it's hard to be good at all those things. So that's why, and I love that people are really getting into these smaller lanes and spaces, because it's just going to keep growing the industry. So yeah.
Yeah, and I suppose, yeah. What do you kind of do you even do you use terms like aggression, reactivity, some of those terms that are very broad when you're working with an individual dog, or do you kind of narrow it down more when you're yeah, working
Yeah,
one
I
to
mean,
one?
I used to be a real stickler for labels, right? When I was big into, I'm just making sure being able to look at the actual behavior through an applied behavior analysis lens and those kind of things. But I've softened that kind of stance over the years, because I think there's going to be people that use terms like reactivity or aggressive dog, and instead of actually looking at the behaviors, and that's totally fine. For me, I just steer the conversation back to the actual behaviors I'm seeing. So yeah, somebody could say, I have a reactive dog. Okay, no problem. I can kind of picture maybe what the dog is doing, maybe on a leash, they're barking and lunging, that kind of thing. But then I just boil down and go right back to the behaviors. Your dog barks and lunges at other dogs when they're 10 meters away, when your dog is on leash in this particular environment. And so, yeah. And so even like my website, aggressive dog, it says, I mean, it doesn't get more labely than that, but that's what people search for. So I do use the terms. I just, when I get down to it with my students or my clients, I steer them down the path of, let's get into the observable behavior. So we're all using this same language when we're describing what we're seeing. Because then that's important to do it that way when you're in that, rather than saying, oh, I have a reactive dog. Okay. And we're working on a case and I'm sharing it with another trainer. So if I said, Daniel, I got a reactive dog case for you out where you are, client contacted me, and I just give you that information when I know a ton of other stuff about the case, dog barks and lunges from 10 meters away, and I don't tell you that, that doesn't help you at all. And the reactive dog label doesn't help you at all, really. It's this dog barks and lunges 10 meters away and has a torn ACL that's compounding pain issues, and the owner's using this particular tool in this environment. That's what's helpful. And so, yeah, the labels I don't necessarily throw in the out with the bathwater, but
Yeah, it's a tricky one, isn't it? Because yeah, I think they can be helpful, right, for kind of just directing people to the right kind of website, the right person to support them with that, right? You need those kind of keywords sometimes, for people to be able to find you and know what you do and get an idea for the general public. Because if you suddenly turned around and said to kind of someone that without any preparation that you've got a reactive dog with leash issues around 10 feet from the door, then that might be a little bit overwhelming for a kind of a typical client.
Right. And we can kind of go back to the critical thought aspect of this, is that if, let's say you have a client that contacts you and they use terms like, alpha or dominance or things that puts a certain picture already in our brain, right? That gives us a little bit of bias immediately when we hear those things, especially if you like if you have your own mindset around those words too, right? Like our own opinions are going to form how we feel about that client right away. So that's where the critical thought is so important. And where I take a step back, okay, so this dog is they might put him, I tried the alpha rolling, I pin the dog down and tell him no, or I pop him on the nose because I need to be the alpha. So there's a lot to unpack there. So if I was to take just a straight hardline approach from going there, like, you can't do that. That's evil. That's awful. You can't do that. Then I'm going to lose that client or lose at least their trust in me. So the critical thought aspect is, what can I do based on this client after having a little more conversation with them to steer them in the direction I want them to go? And that's where I have to change my conversation skills in that moment. I have to adapt to how they are, almost like being a chameleon with good critical thought, right? You're adapting how you're talking to that client based on how you think they're going to digest the information you're giving them, as well as your tone and your approach and the words you're using. That's the beauty of consulting for me, is that if you can get really good at convincing people, after you've put some thought into how you're going to do it, it's just it's so rewarding for me to see that change when you start to really come up with these conversations, or you go through these conversations in a way that can make that change. I love when I see that. Doesn't always happen, of course, right? Not every case is like that. We all know that, but it's so nice when we do see that.
Yeah, and I suppose you're upping your odds, right? If you come in with kind of as wide a toolkit as possible in terms of some of the terminology and language that you can use in terms of adapting to that individual client, then you're going to up your odds of getting those successful cases and getting things running very, very smoothly, rather than having one of those slightly tougher conversations that we've all had to have. Yeah. Okay. So something I wanted to touch on a little bit as well today is, at the moment, there's obviously a lot of different approaches out there, and there's lots of different approaches that we all discuss and kind of talk about and might see webinars, conferences, training for. So there's a lot to navigate for dog trainers, behavior consultants, in terms of not only individual cases, but also looking at some of the different approaches that are out there. So I suppose was just thinking of is obviously we've got constructional aggression treatment. We've got the brilliant behavior adjustment training, BAT, Grisha Stewart's BAT. There's I suppose the kind of the umbrella category of kind of dog-centered, relationship-centered approaches, which are also really, really growing in popularity now. I don't know if there's any more that come to your mind, but there's a lot to navigate, right? Isn't there? As training behavior consultants, not just in terms of individual cases, but also in terms of the approaches that we have and that are out there.
Yes, yes, I love this question because it's actually it's making it's kind of coming full circle for me, because I actually was talking about this, kind of thinking about this many years ago, and again when I was taking more of a behavior analysis approach, almost like a strict behavior analysis approach to modifying behavior, is that every of those approaches, every one of those, whether we'll use the acronyms like BAT, CAT, LAT, any of those, you can explain what's happening through one of the behavior sciences. So at the time, I could explain, this is what's happening in constructional aggression treatment. It's a negative reinforcement procedure, or original iteration of BAT 1.0 is a negative reinforcement procedure. And you can kind of unpack and define exactly what's happening. And I was like, okay, so we can actually look through the lens of these sciences to say, this is what's happening. But that's still narrow when you do that. So what we want to do is, okay, what's happening from an ethology lens? What's happening from a neuroscience lens? What's happening at an emotional level? And starting from a behavioral psychology level. So looking at it through different lenses is going to help us with our critical thought, because what can happen is then you kind of, if you get into a mindset of just looking at it in one way, you start having arguments with people. That's where the conflict comes in. We have discussions, and you see it online. And that's the issue too, with, in the dog training space, we don't know always what somebody's background is. Somebody can have a background in ABA, somebody can have a background in neuroscience. So they might be approaching and using different language. You see it between academics and the folks down in the field doing things all the time. It's just the conversation style as well as the language they're using. So using that critical thought, we take a step back, and when I see these conversations, first thing I'm going to ask myself, where's this person coming from in their background and knowledge in my conversation with them? So going back to your original question, I'm like, whether it's BAT, CAT, LAT, RAT, there's so many ATs, but all of them are explainable through any of those lenses of science. And that's the first step. So let's explain it through our lens, what I'm seeing that's happening here. And let me hear what your viewpoint is and what lens you're doing. And maybe you're coming from an ethology side of things, or some other background, behavioral ecology, whatever you're studying, or maybe that's where you're getting your information from. Because if we don't start there, that's where the conflicts happen, because there's a language. It's almost like a language barrier, right? And I also want to say, I think it's wonderful that that so many trainers like Grisha and Leslie McDevitt and some of these wonderful trainers are putting a name to what we've been doing for many years in many cases. So operant behavior, classical conditioning, stuff we've known about for over a century, and they're just turning it into a product or a thing or whatever, however they want to get it out there in the world. I actually love that, because if we don't have that, it doesn't catch the eyes of people, the attention of people. So yes, somebody can take something that Skinner did many, many years ago and then put a name on it, or put some sort of, catchy title to it. Totally fine with me, as long as, again, they credit the original science. But once they do, put it out there, because that's going to attract more people. If you have some sort of product or name or acronym, whatever you want to put on it, I love that, because it helps spread the information further. And my clients in other countries are a perfect example. They're not saying, I studied Skinner and Pavlov. They're saying, I checked out BAT, or what about this Leslie McDevitt? Look at that, or so just want to put that out there too.
Yeah, and I think, we are really lucky that there are some absolutely fantastic protocols out there now, which is so good. And it kind of, I think, in your own, or in my own head anyway, streamlines things a bit, that I can think, okay, yes, we can look at that. Would that be appropriate? Would this be helpful? Because rather than kind of having to just think about the individual little kind of mechanics that might be involved in those methods. You're kind of able to see them as a whole, and also, you know, get the brilliance of the insight of whoever's written it in that book and how they've applied it, and get their case studies of applying it, which is so handy to have as well. Yeah, I think yeah, like you say, it's really beneficial to have that kind of product out there, because it does kind of become big as a name in itself, becomes a product in itself, which is, yeah, I've had clients like you, I think, that said, yeah, we've been trying BAT already. And I'm like, oh, brilliant, that's great news. How's it been going?
It's amazing. I mean, and then, you know, let's use an example too. Let's use constructional aggression treatment. So Dr. Jesus Royales Ruiz and Kelly Schneider were the original sort of the originators of that, and it was Kelly's master's thesis. So it's a technique, if you're not familiar with it, if you're listening in, it's a technique that uses distance to increase desirable behavior or reinforce desirable behavior in a dog. So the dog's, the original iteration, dogs barking and lunging at something, they're on a leash. The other dogs are, let's say it's a person actually. Another person is in the distance, and the dog's barking and lunging at the person. Dog doesn't want the person there. So that person moves away once the dog gives us anything else other than the barking and lunging. The newest iterations of cat, it's not stressful like that. We look for much more less stressed behavior. So we don't wait for barking and lunging. We look at, instead of staring at that and scanning, let's wait for you to just look at the ground, and we'll mark and reinforce that, and the person will move away. So the dog is learning, okay, if I just look at the ground or do anything else other than the undesirable behaviors, that'll pay off for me because the person will move away. And eventually you just decrease distance, and you get what's called a switch over effect, where the dog's like, this person's not so bad. They get me. They understand their, you know, when I want them to go away, I can make them go away. And so you get the switch over, and the dog gets kind of curious and like, what are those persons about? And they end up, you can usually decrease distance. So that's the cat in a nutshell. But when I'm looking at it from a critical thought lens, if I'm just starting out and I'm learning, okay, I got this new technique, it's called cat, I'm going to do this, we might not even address like what's really happening for this dog. So if we look at the cat lens, we're like, okay, we're using distance to increase desirable behavior. But if we look through some of the other lenses, that's where we have to have the critical thought. So if we look at through a behavior analysis lens, we're like, okay, this is a negative reinforcement protocol, a contingency of the function is person going away to reinforce desirable behavior. But then I might look through an ethology lens. Maybe it's a German Shepherd that is from working lines, that's barking and lunging at a person. And I'll be like, okay, so here's some breed-specific tendencies that we might want to add into our thought process here of what we might want to change or modify or adapt. Maybe this German Shepherd's having a good old time doing what it's doing, and we might not be using the right procedure. Or we might say this dog is very fearful, and we need to switch to maybe like go back to trying to counter condition. So you might think through that lens. You might look through your medical lens, like, oh, this dog might have, I see that this dog has sort of a little bit of muscle wear on the right rear leg, or the left leg is just a little unbalanced. You might say, ooh, is there a medical issue going on that could be impacting how this dog is behaving or increasing the likelihood of the behavior? You can look through all these different lenses. You know, you can look through the neuroscience lens. I can let you take that one, but all of these different aspects of, there's your critical thought. Because if you miss that lens, if I just go in, oh, it's a cat procedure, we're going to just get distance, and I might miss the medical, or I miss the German Shepherd part.
Yeah,
that's where you run into trouble. So we always have to be looking, always kind of thinking, what else?
Yeah, and what just jumped out at me with that example as well is if we're taking that cat example, so it's primarily obviously a negative reinforcement procedure, right? If we've got that example of the German Shepherd who's actually quite enjoying this whole lunging at strangers thing and thinks it's quite a fun game, and we've applied cat and that's worked, then chances are, if we go kind of back to behavior analysis, we could actually argue that you've not used negative reinforcement. You've used differential reinforcement, because you've been kind of rewarding the dog and giving them some space and doing something else when they've not reacted to that person.
Or we might be using desensitization. So that's where I love this. You know, again, you get into thinking about what's really making the change here for this dog. If you look at the emotional level too, if you look at an effective neuroscience lens in terms of what's happening in that regard, I mean, is the dog happy about this, or is the dog having rage or frustration or anger? You know, so there's so many ways of looking at it, and that's the nuances that I love to unpack. And you know, again, goes back to that critical thought. It's just
Yeah.
so important in these cases. Yeah.
Yeah, and I think that's a perfect example there in terms of as well integrating those different things, because it does it is going to give you such a more well-rounded view in terms of the interventions you can make with that particular dog. So yeah, it's all very interesting to think about. And I suppose within that as well, when you are looking at a case and you are kind of troubleshooting some of those interventions, do you ever have a point where kind of you're working on something like, say, I don't know, cat or bat or whatever you might be working on? I think what can be tough for people, and obviously we know that we have a bias as well, we have this sunk cost fallacy effect, in the sense that, meaning if you've put effort into doing something, so you've put effort into applying cat training for this particular dog, it's going to be tougher for the caregiver, it's going to be tougher for the behavior consultant to actually kind of give up on what you've been doing and try a new strategy, because you've kind of focused on that strategy. It's like if you've been waiting in traffic for ages, it's tough to then turn around and go the other way and kind of give up on all that time you spent in the queue.
Yeah, that's a good analogy.
So yeah, how, yeah, I suppose, how do you tackle that issue of considering when it might be time to change strategies with some of these approaches that you're taking?
Yeah, the first thing is to, if again for the trainers and consultants listening, is to make sure during your first consult that whatever strategy you come up with, you tell the client, we're going to try this first because this is what I think will most likely work in your case. However, there's other things we can try if this doesn't work, and we may need to shift gears at some point. So I do want you to be aware of that. Do you understand that? Very important, because if they think that this is your one, trick, or the one thing you're going to try and it doesn't work, guess what happens is that either they lose hope or they fire you or they lose hope in you, right? So it's important, just a side note, put that out there, like, okay, there's other things we can try. And so I tend to, this is experiential, right? Like, it depends on how often you've used a particular procedure, how much you've seen it work in other cases. You get sort of your head wrapped around what would typically take the amount of time. So like, one of the big questions I get is like, if I'm working with a dog that hates strangers or somebody coming in the home, how long does it take for that dog to warm up to you, where they're okay with you, where you're not worried about getting bitten and the dog's like showing affiliation towards you? And for me, I've determined that's about three visits, where most dogs, if regardless of the level of issues they have with strangers, are going to generally warm up to me. Now, critical thought says sometimes it might be in 1 minute. So the dog's like, wait, somebody's chair. Ooh, you have cookies? Okay, you're in. And then the other one's like, I don't care what kind of cookies you have. It's going to be months before I even trust you coming near me. But on average, it's like 3 months. So you start to picture, you kind of set these general averages. So if I was using a procedure like bat or cat, I'm going to have, if you have experience using a particular procedure, you base it off that. Be like, okay, in my previous cases, it took this long. And I'm putting critical thought, why is this not working? Is it something in my environment? Is it something I'm doing? Is the distance not right? Is the intensity too much? Is the dog not feeling well today? Were there other environmental stressors going on? Is it the dog's social maturity kicking in? Is it something the owner's doing? That's really important before you switch gears. Because if you don't critically think about that, you might switch gears too early. You might say, oh, that thing's not working, 1 month, so let's try something else, without realizing, oh, it's because simply we had to change the distance, or maybe there was a piece of equipment on the dog that was, a little too tight or restrictive, or these little things that might impact it significantly. So always, for me, it's always looking before you make that shift, be like, why am I making that shift? Why do I think I need to make this shift? And is there anything else I can do before I make that shift to ensure we're not just throwing this out, right? So that I do with all my cases. It's so important, because what can happen, as you mentioned, I love that. Like, it's like you turn around, but then the highway suddenly clears. You're like, oh crap, right? Because you just kept going that way. That can be frustrating as well for the client. So, and the dog,
Yeah, there's so much to think, and that's interesting, isn't it? As an example, that idea. So if you would say working on cat, as we keep using that example, constructional aggression treatment, and you had a really good cat protocol in place, and mechanically everything was going perfectly, and an owner couldn't be doing a better job, that could be maybe that it could be just not an appropriate treatment for that dog. Or we could maybe need to look at the fact that has this dog actually got their other welfare needs met? Have we addressed the fact this dog is getting like 2 hours of sleep a night? Or have we addressed the fact that this dog isn't feeling well? Or have we addressed the fact that this dog, is essentially not kind of having their welfare needs met during the day? It's getting scared a lot during the day. Or even something kind of down to a management protocol, right? You can have a really good management protocol, but it can result in the dog actually not having any kind of quality of life because it ends up being so restrictive. So there's all these kind of things you have to balance it rather than just relying on one intervention. And I think that's where it becomes, again, really tricky. That's what your AI can't do, right?
Exactly. Exactly. It's not going to pick up on the things that we can see through experience, right? At least not yet, until we feed it enough case studies. But yeah, you said it all right there, Daniel. It's just like looking at all of those details, and those details come to us over time, right? It's not something you can learn overnight, and that's okay. As long as you have that imposter syndrome, you'll check yourself and be like, "Ooh, did I miss something here?" And if you did, that's okay. You're going to miss things for the rest of your life. We just continue, if we just keep adding to our knowledge base and to our experience, and we're making sure we're checking ourselves and ensuring the data is showing us that we're moving in the right direction, we're doing things accurately, we're relying on science, it's okay. We're gonna have errors, we're gonna have mistakes, we're gonna say the wrong things, we're gonna say things that we shouldn't have said, and you realize it. And trust me, there's things I could go back to even like 5 years ago. I'm like, God, did I really say that right? Or like me, I have to even be more responsible, because if I'm presenting, or if I'm at a big conference in front of 500 people or something, and I say something, I might influence 500 people, which can then influence their 500 clients each, which then influences thousands and thousands of dogs. So I have a big responsibility to double check what I'm saying, triple check. But even then, it's you're going to say things that you will regret later on. But that's okay, as long as you recognize that and you grow and move from that. That's the most important part. Because if you keep going for the next 20 years saying the same wrong thing without checking yourself, that's where it's a problem. So
Yeah, and that's really tough, right? Because I imagine a lot of the training methods that we do use today are probably going to look very different in 20 years, right?
Exactly, right.
Yeah, and what do you think? I mean, this is a tough question, but is there anything that you think is exciting in the world of training at the moment in terms
Oh God,
of?
there's so much exciting stuff happening right now. I mean, just what you're doing is one of the perfect examples. Like seeing other sciences really come into the mainstream. So neuroscience is a big one for me. Ethology coming back into the mainstream. The really focusing on the dog's needs, as well as the human's needs, and supporting both parties, not just looking at, okay, we've got to get the dog to do A, B, C, right? It's let's look really deeply at the emotional level of all of the people and animals that we are working with, because that again just lets us go back and see the whole picture of what's going on in a behavior case. So yeah, relationship centered approaches, we were talking about that earlier. It's a beautiful thing to see, because it's so much more than sit down stay, what we had. Not that anything's wrong with those things, but for many years that's what we were focused on: sit down stay, he'll come, right? And then we got into other things, we started to learn about emotions and classical conditioning, but now we're really diving deep into understanding trauma and understanding the dog's needs and enrichment and how the nose works, right? That's another exciting one. Just how much the nose impacts behavior, and the science behind it, and the research that's going on. There's so many exciting things, and AI, right? So I mean, we're seeing, and I'm seeing this all over the place on social media. It's really exciting. Yes, you still see some bad stuff, but I have to say I am seeing the growth of trainers, young trainers, is exponentially. Their knowledge and their learning curve is just taken off much more than when I remember 15 years ago, even 10 years ago. We were learning things, we were reading books, everybody was talking in the groups about some of the mainstream books like Click to Calm or something that came out. But now things are just, people are learning so much faster and at such an exponential rate. I love that. It's also like makes me think, am I going to be able to compete in the next few years? Just because I'm trying to keep up with all this information and stay relevant, right? Which is that's okay. I mean, if it keeps going the right direction, just you can put me out in a chair somewhere on a beach, I'll be fine. If the
Well,
dogs
I'm
and the people in the
sure
world will be okay.
I'm sure you'll still be needed in 10 years, don't worry. Yeah, I can't see it happening, but yeah, yeah, I think your course is particularly so useful to so many people, but
I
but
appreciate
yeah, it is amazing how much development there is, and I think it also comes down to perhaps a slight shift in thinking in terms what our goals are in the dog training industry, right, or the dog behavior and just the pet industry, I suppose, which I think, kind of to my view anyway, even kind of when I started doing this, which isn't a desperately long time ago, it's, I would say, is shifting from being training focused for our end goal being a really well trained dog to a dog with really good welfare. And I think, I don't know if this is something you see as well. I think that's kind of often where we get our wires crossed with other people in the industry, because if you've got someone that's focused on training goals, then using a kind of a broader set of approaches is probably going to be really good in terms of achieving that. It's probably going to be really effective on the whole in terms of achieving that. But if you're focused on kind of really achieving the greatest welfare possible for that dog, then you probably are going to be focused more towards the positive reinforcement end of things.
Yeah.
And yeah, it's I think it makes those conversations really difficult, because a lot of people are coming from very different places there, and I think it's even hard to say any particular place is wrong, because a lot of us eat meat, a lot of us do a lot of things to animals, so you could, there's an argument that training that is uses punishment based or doesn't enhance welfare to the best it can be for a dog isn't isn't comparatively as bad as other things that humans maybe partake in. I don't know.
Yeah, it's for me, it's almost like we're, the way we used to do things, and some people are still doing it this way, of course, is you're almost like treating the symptoms, right? So teaching a dog to sit or go to a mat, right? If they're afraid of Uncle Bob coming through the front door. Yes, that looks good. And you can train that either way. You can train it through positive reinforcement. You can train it through whatever, punishment-based, negative reinforcement-based procedure. Get that dog to go to the mat. Dog won't bite Uncle Bob, but the dog is still fearful of Uncle Bob. So we're seeing this beautiful shift. It's sort of like almost like the medical industry, right? It's like you have doctors that treat the symptoms, but not a lot of people were talking about, let's get to the root cause of what's causing these symptoms in the first place. It's the food we're eating, the exercise we're getting, the climates that we live in, all these other things that impact our health. And I'm certainly not discounting, health issues that aren't related to those things. But a lot of these things we're seeing where we're treating the symptoms of things that we can change doing lifestyle changes. So I love that we're seeing that with dogs, is that let's do lifestyle changes for our dogs so that they don't have the symptoms. All right. So that we're taking them, excuse me, we're getting them from these really tightly managed, low enrichment situations, and understanding that to fix these symptoms, let's change that. Let's get them out of this strict, really obedient mindset of like, let's just focus on it. And I love that we're seeing that change in the industry. So, and it's like anything else, it's going to take time to make that shift. It's not going to happen overnight. And that's where, just like, in the medical industry, we're not going to see any changes overnight in regards to that, because that's also not where the money is either, right? Like, but fortunately it's not quite the same for dogs, because we're all, if we're working as training or behavior, we're kind of all focused on let's fix the issue, but there's different approaches to it. And so as we keep moving the industry towards let's focus on the dog's needs first and their quality of life, then you can see so many behavior issues start to really, reduce in the frequency and the percentage that we're seeing them. And that's my goal. Again, that going back to, getting out of our echo chambers, getting out of where we see things. Because I see this phenomenon traveling. I'll go to a country or small country, maybe I've been to places where populations maybe 500,000 or something on an island, and there's a unique view of the culture of dogs there. But that view of dogs might be very heavily punishment based, right? And so that might be a real shock for somebody that's going there as a trainer, or that client from that particular country is seeking out a trainer in the US. And if we don't take a step back and realize that and put some critical thought of where this person's mindset might be in their culture, their experience with dogs, we're going to fail them miserably, because we have our mindset of like, whatever it is, sit down, stay calm, or this is your dog needs, we need to meet your dog's needs and all these lovely things. But if we don't get into that client's mind, we're going to completely lose them. So just to hit on that critical thought conversation piece we've been talking about the whole time, so important. So it's important to branch out, right?
Yeah, it is, and it's so interesting to see that kind of welfare shift as humans are becoming more welfare conscious. But obviously, we, I suppose, can't assume that everyone else is coming from that point of view generally, even though kind of on the whole, more people are coming from that point of view. Not everyone's coming from that point of view. I mean, one thing that you just kind of made me think of there as well is so not only in the dog training industry, we kind of see these changes throughout kind of any animal related industry. So in neuroscience, unfortunately, a lot of people know a lot of research is done on rats that often don't have the best time in terms of that research, unfortunately. So it's a really tricky one. It's to kind of ethically manage, because research on rats has saved countless human lives and countless other animal lives, but it's also been very miserable for a lot of rats, unfortunately. So there's a shift now in kind of with research into animal research in terms of what you're allowed to do with rats in the laboratory. And I remember having one professor fairly recently that was really grumpy about the fact he couldn't do certain things to rats anymore. And that's one way as well. I know there's vets that work in laboratories as well that are kind of there often really standing up for animals in those situations, which is kind of, I think, one of those things as well that we don't even appreciate that vets do as well. But yeah, so I'm going slightly off topic, but yeah, I think that shift animal in terms of to a kind of more welfare centered approach is happening kind of very, very widely, not just in the dog industry, not just in a particular kind of region of that. We are becoming more conscious of that.
Definitely. Yeah.
One challenge I do see with that, I don't know if this has occurred to you as well, but is again with dog training, right? We know about that kind of reinforcer and stimulus reinforcer or cue reinforcer timing is really important. And one of the challenges, of course, that we face with that, with becoming more health conscious and kind of managing that kind of welfare side of things, is this is a lot of kind of behaviors that we're putting in, or kind of put money that we're putting into the machine, right? That's going to pay off a long time in the future. Like it's like if you're dieting well, that's not going to pay off immediately. That's actually going to suck a little bit immediately because you can't eat the nice food that you wanted to eat. But in the future, it's going to pay off. So yeah, do you have any thoughts, I suppose, in terms of how you manage that kind of delayed gratification side of things in the human and dog side of things?
Such a great question, because our mindsets often, when we're trying to fix something, we want to have a clear path where we see it almost like a light switch. So I want to fix my dishwasher. I want to fix my flat tire. We have a beginning and an end to it. When we're looking at something more of, I was like, if I take your car to fix a flat tire, you're going to wash it and you're going to, make sure it's in a good spot. That doesn't make sense to most people, right? But if I said if that flat tire, which it won't, but if we were using something like that, the flat tire will reinflate and fix itself if we wash the car and keep it in good shape in other ways. That's a hard thing for people to wrap their mind around. So it's very, very crucial for two things for me, is that make sure the client understands why we're making these changes. They really have to understand why. If they don't understand the why, they're not going to do it. They're like, what the, what is this for? Why is my dog sniffing around on these weird scents or whatever? It doesn't make sense. They need to walk nicely next to me or something like that. So They have to understand the why, and then I have to make it easy for them to do. So if it's a lifestyle change for the dog that's going to benefit them, is it going to be easy enough for the client to carry through on? So we have to get creative. This is where the creative thinking in the what we recommend to clients can be very helpful. So maybe a client doesn't want to go for long walks out in the woods where the dog can go sniff everything. Maybe the client can set that up in their backyard where there's different scents, and we show them different scents you can order online and scatter around the backyard for enrichment. That can potentially significantly benefit a dog that's been so restricted its whole life because of the aggression issues. So I tried to do those things. They got to understand why, and we got to make it easy for them. And then you're often going to see that typically they'll start to see, all right, let me try this. And you just got to stay on top of it too. Be like, remember why we're doing this? Because if not, they're going to stop doing it. And we can't make it inconvenient for them either. So if I'm like, no, you got to take your dog for 10-mile hikes in the woods every single day, they're not going to do it. So that would be inconvenient to them, and it's not going to be followed through on. So those are the keys to success in that department. Because the other stuff, usually the clients are like, yeah, I can totally teach a sit and treat and do this 5 minutes, 10 minutes a day, whatever. But if it's something that doesn't seem like it's impacting the behavior, not. So I think that's going to be the next challenge is, or somebody will come up with it. Maybe somebody listening in, like a good strategy, good scripts or ways of communicating these crucial conversations with clients that to get them to understand the needs for meeting the dog's, the need for meeting the dog's needs.
Yeah. So understanding why we're doing it, and then understanding how to do it practically and easily. Yeah, it is tough, isn't it? Because I mean, even thinking back to your Aggression in Dogs conference, we had that amazing talk with Dr. Simone Gabois. That was one of the toughest things I've ever listened to. It was brilliant, but I've had to listen to it 3 times to feel like I can understand it. So when you're kind of dealing with those concepts in a 90-minute, 2-hour consultation, that can be it can be really tough to get across some of those concepts, right?
Yeah, it's why practice and kind of running through what you did before, again, going back and checking your work. In other words, you do anything that you want to have a quality product on, you got to go back and double check your work. So that's what I used to do actually on my drives home for my clients. I would go back, is there any way I could have communicated that better? Is there any part of my consult in my conversation that I could have improved upon? Just a nice exercise to improve your consulting skills, because we do it with our dogs all the time. We're like, oh, is there anything in that training session I could have done differently? But we should always be thinking about how can I have better conversations with our clients, and just in life in general with people, right? With our social media conversations with a person that we might meet on the street. I'm always thinking like, how could I have had that better? Is there anything that upset that person that I might have said? Is there anything? And try to think about it. Sometimes it helps, sometimes it doesn't, of course. I can't, maybe that person doesn't want to have any more conversation with me, but the vast majority of the time it's good exercise to do. So
yeah, I think that is really helpful, because it is easy to kind of just, if you have done something wrong, right, as well, just kind of focus on beating yourself up and thinking, oh, I did a crap job of explaining that. If I'd explained that better, then the person would have been on board and we would have seen. Yeah, it's kind of, it can feel like a lot of pressure dealing with those conversations sometimes. So I think, yeah, if you're funneling it into kind of just being able to improve in the future, then that's all you can do really, moving forward. And yeah, the other thing that as well jumps out at me is sometimes we've got those really hard concepts, and sometimes you've also got those concepts that we've been doing for so long, like that kind of basic kind of associative learning, that it's almost so easy to us, because we're just so used to it, that it becomes almost a challenge to remember to explain, oh yeah, actually this guy doesn't know about like basic operant and classical conditioning or stuff like that we're kind of so used to talking about in day-to-day life.
Right. It's so, again, go back to just make sure that what you're saying is working. And what's the beauty of doing that too is that you'll also recognize what works really well. So you just start regurgitating the same analogies or things like that are going to work well with most clients. So that's the other beauty of that exercise, is you figure out what you need to change and what works really well. And so sometimes, like, if I had this, I was always kind of like worried, like I'd go into I'd have a lot of trainers shadow me, and they come watch me on my consults, or just to get an idea of how I do my consulting. Then I realized I was like saying the same thing over and over to a lot of clients. I'm like, what if this person shadowing me is like thinks I'm kind of a little bit weird because I say the same exact thing sometimes in a good chunk of the consult from one client to the next, just because I know it's such a good analogy for one example, or I know they have somewhat similar cases. But I, like verbatim, I can sometimes I'm saying the exact like a recording. It's like press play, and there it comes, because I know it works well because I've revisited and I thought about that particular analogy. And I do the same thing with my presentations too. You know, when I'm teaching trainers or doing a workshop or conference, I tend to say what I know is going to impart the message the best I've found to convey that message. So
Yeah, I think, yeah, those analogies can sometimes be really handy for kind of making some of those concepts
yeah,
graspable and easy, and
100%.
also kind of mnemonic devices for yourself as something to remember when you are kind of yeah, relaying that information to your clients, or obviously in your case, your various audience for your conferences.
Yes.
Yeah. Okay. Well, we've already gone over, so I apologize for
Wow,
that.
time
But
goes fast. It's a good
thank you
doing a
so
good
much
combo.
for joining me today. It's been fascinating talking to you. Before we finish off, is there anything you've got coming up, anything really exciting in the pipeline that you want to mention that the audience today might be interested in?
Yeah, there really is two big things happening right now. It's the podcast episodes that I've recorded. So this is season 4 of The Bitey End of the Dog. Last week was Patricia McConnell, and this week I released Dr. Eddie Fernandez's episode, and I've got 17 total episodes this year. So worthless. This is a really good season to kind of sum up a lot of what we're talking about with the human side of aggression cases and working with humans. So I've got that, and you can listen in on any podcast platform. It's The Bitey End of the Dog. And there's also the Aggression in Dogs Conference coming up in September, the end of September. Aggression in Dogs Conference happening both in person and online. It's going to be in Chicago this year. And then also available online anywhere in the world you have an internet connection. So yeah, you can find out all that. All that's on aggressivedog.com.
Brilliant. Aggressivedog.com, and I can pop that in the links for today's video. And yeah, I see you've got some brilliant speakers as well lined up for the. I haven't seen the podcast speakers yet. I usually kind of binge a podcast once it's all out in one go, so I can keep it consistent in my head. But I've see you've got some brilliant speakers lined up for the Aggression in Dogs conference. I saw you've got Sindor Pangal coming to that one, and
he's flying up from India, so I'm excited for that for sure.
That's amazing. So yeah, it looks like an absolutely fantastic one. So I'll look forward to tuning into it. So yeah, brilliant. Thank you so much for joining us today. I'll pop this chat up on YouTube as well and on our Facebook page. So if people want to review things after the event, you can go back to it and check it all out and go over bits. So it's been great talking to you, and I'll see you soon.
Thanks, Daniel. I appreciate it.
No problem. Thank you. Bye-bye.